It's an organisation that also represents pharmacy students who are coming through and looking for opportunities. There was a clear commitment within the long-term workforce plan to grow the number of places for pharmacists coming through, I think between sort of 30 and 55% for education places. And I think this is one of the examples where pharmacy sits in a slightly different place to other professions. So, for example, in nursing, in midwifery, in other allied health professionals, in medicine and dentistry, they have access to the Learning Support Fund. And that gives an opportunity for pharmacy students, well, in those professions, it gives opportunity for those students when they're going out on clinical placements, taking on more clinical roles, to actually have funding for their accommodation, for their travel, for their ability to go to these different sites. And what we're seeing is that at the moment we're seeing shortages in particular areas of the country, and it's always more challenging in more rural areas and different areas. And one of the ways to address that is to get students to go and do placements in these areas, for them to understand what practice is like there, because then they might go on to practice there later. But at the moment, pharmacy is excluded as a healthcare profession from having access to that fund.